Welcome to Healthcare Today. In today's show, we're going to discuss heart disease, which heart disease still remains the #1 killer among men and women in the United States. In today's show, I'm going to be joined by the physicians at Dasher Heart Center, located at South Georgia Medical Center. Their expertise will lend us tips on staying heart healthy and warning signs we may need to know. My first guest is Dr. Luke Seabolt. Welcome, Dr. Seabolt.
Thank you.
And you are an interventional cardiologist, is that correct?
Yes, ma'am, that's correct.
Okay, and I understand you kind of had an inspiration to fall into the field of cardiology. Tell me a little bit about that.
Yeah, absolutely. My father had some heart problems growing up, and I always enjoyed learning about what was going on with him, the doctors he met with, some of the therapy that he received. That always kind of perked my interest into cardiology and ultimately led me down this path now.
Okay, and so in today's show, we're going to talk a lot about heart health awareness and understanding that it is the leading cause of death in the United States. I want to start off by help educate us on what are just some common types of heart disease.
Sure, so I'd say the most common by far and away is coronary artery disease or blockages of the heart arteries. Some of the other common heart disease types include heart failure or reduced function of the heart, valvular heart disease or abnormalities of the heart valves, or even electrical abnormalities called arrhythmias.
And then what are some risk factors for some of these heart disease?
Yeah, so the main risk factor for coronary artery disease is high blood pressure, hypertension, also hypercholesterolemia or elevated lipids, diabetes mellitus, tobacco use, even genetics can predispose you to coronary artery disease.
That is a big category, hypertension, which many people suffer from. Is it more important just to keep it under control?
Well, I think acknowledging and recognizing it is first, and then obviously once that diagnosis has been established, keeping it under control. And not just with medications, but also with lifestyle changes, dietary changes, some several other things that can help decrease your blood pressure and can ultimately help you get off of medications if needed. And
would it be common for someone maybe not to have some, warning signs or risk factors and have heart disease?
Yeah, absolutely. It can creep up on you, that's for sure. It can develop at a young age and progress from there based off of your risk factor profile. Not everybody has your kind of textbook heart attack where you read about or see in the movies where they grab their chest and fall over. We know females and diabetics sometimes present atypically with shortness of breath or with arm pain or jaw pain. And recognizing those symptoms ahead of time can help kind of, escalate your care to make sure that we're getting you appropriately diagnosed.
I do want to talk about some of the warning signs. So you mentioned jaw pain. Tell me the warning signs that someone should pay attention to.
Yeah, so the main one's pain in the chest, obviously, kind of a crushing pressure type pain in your chest. Sometimes people describe having an elephant sitting on your chest can be one of the descriptions. Other people, there's like a band or a vice-like device around your chest in a squeezing manner. That's kind of your textbook symptom. Associated with that, you can get shortness of breath. You can get sweaty, you can get nauseous and even and vomit or throw up. Sometimes that pain can radiate to your jaw, it can radiate to your arm, it can radiate to your back. And these symptoms can occur with rest or activity. Most typically they do occur with activity, but if they do progress to occur at rest, that's definitely something that needs to be taken care of urgently.
And then more on the screening sides, let's talk about catching things early. Our annual visits, are these things you encourage your patients to make sure they're continuing to do?
Absolutely, absolutely. I feel like we should use this more of a team model instead of kind of staying in our own silos of cardiology or primary care, but working together to try to help establish these diagnoses early and also catch them early to prevent further progression of the disease. And that's called primary prevention, trying to prevent the high blood pressure, prevent the high cholesterol, prevent the diabetes, acknowledge smoking and trying to quit early. And then doing what we can to modify risk factors that you can't necessarily change.
Okay, and now taking a little step further, once somebody has presented with those symptoms and you want to further investigate, what are some ways you can go in there and diagnose and see if they actually have heart issues?
Yeah, exactly. So one of the main things we work with is what's called an EKG or an electrocardiogram, and that's a tracing of the heart's rhythm and also kind of shows us exactly some possible abnormalities that can suggest heart disease. From there, things like blood work can help us identify abnormal lipids or even troponins that look at injury to the heart muscle. Echocardiograms or ultrasounds of the heart show us heart function and structure. to allow us to see if there's any wall motion abnormalities or any abnormalities that can suggest heart disease. And then ultimately, someone may require a coronary angiogram, where we actually put contrast dye within the arteries themselves and look for blockages.
Okay, and then that's something common also people hear is, someone had a cath. It doesn't always necessarily mean they have to have stents or anything. Is that correct?
Correct, yeah. I think the national average is about 30 to 40% of heart caths are what are called diagnostic caths, meaning that they actually don't require stents. Those numbers change based off your risk profile and whether presenting from home or presenting through the emergency room. But not every heart cath does require some sort of stent or revascularization procedure.
And then that's the beauty of that. In that diagnostic procedure, should you find something, you're able to take care of it right then?
Yes, ma'am, right away. So someone can come in, we can diagnose and treat immediately on the spot there, and then move forward with medications, move forward with getting back to a healthy lifestyle.
And have you seen advancements with the technology and using stents?
Even in just my short career, we've come a long way. One of the main ways that we get access now is through the wrist artery. We no longer go through the groin artery unless we have to. So I prefer to go through the wrist artery, which is much easier for me, easier for the patient, and the bleeding risk is much lower. The stents have only progressed and gotten better. They're thinner stent struts. They're easier to deliver. The drug coating has just become more and more advanced, and we're able to actually come off of some of the blood thinners earlier because of the advancement in the stent technology.
That's great. Well, you've given us a lot of great information, and again, we just want to encourage patients to reach out when they're having symptoms and to stay heart healthy.
Absolutely. Thank you so much.
Well, stay tuned, and when we come back, we're going to learn more about heart disease and what you need to know. Stay tuned.
Healthcare Today will answer today's medical questions so you can live a healthier tomorrow. If you'd like more information on Healthcare Today's guests or watch previous shows, visit walb.com/healthcaretoday. If you're a healthcare professional and would like to appear on Healthcare Today, contact Kelly Roberts at 446-4074 or email her at kelly.roberts@walb.com.
Welcome back, and I'm now joined with Dr. Kamil Hanna, electrophysiologist at South Georgia Medical Center. Welcome, Dr. Hanna.
Thank you.
I want to start off by helping us understand what is an electrophysiologist and what is it that you do?
So, electrophysiologist is a cardiologist at the base, and we do study and manage heart rhythm disorders that we have, such as low heart rates, bradycardia, or rapid heart rates, tachyarrhythmias, and this involves a wide variety of procedures from implanting pacemakers and defibrillators to ablations of arrhythmias and monitoring heart rhythms down the line.
Okay, so the difference is, then you versus a cardiologist is you deal with, would you say, our electrical system in our body?
Definitely. The electrical system of the heart is a complex structure, and it can suffer a variety of disorders, some of which are genetic, some of which are inherited accordingly, some of which are acquired as we grow older in life. And for example, patients with heart disease and myocardial infarctions can suffer from a variety of rhythm disorders and weakening of the heart muscle, such as cardiomyopathy, that eventually can lead to the ICD implants as a prevention measure from the risk of sudden cardiac death. And on the other extreme, you can have patients with rapid heart rates, such as tachyarrhythmias, and again, the predisposing factors to that could be genetic disorders as long QT syndromes or short QT syndromes or Brugada syndromes that eventually, if the patients have had an event of syncope that is passing out or sudden cardiac death, that usually leads to ICD implants. Other conditions such as post-myocardial infarcts, they can lead to cardiomyopathy and put that patient at risk of sudden death. The current guidelines in the United States and the Heart Rhythm Society states that if a patient has a persistent cardiomyopathy 90 days after myocardial infarction and revascularization, despite guided medical treatment, then that patient would qualify and would benefit from an ICD implant to lower the risk of sudden cardiac death.
Okay, so and you mentioned atrial fibrillation. That is something commonly people may hear that they have. What are some symptoms that someone may have if they're suffering from AFib?
I'm glad you asked that question. In a data published by Gerald Naturelli in the American Journal of Cardiology back in 2009, statistics at that time predicted that about 3.1 million Americans suffer from atrial fibrillation, and he predicted that the number will double by the year 2025. However, more recent data from 2016 statistics on stroke in the United States published by the American Heart Association showed that already in 2016 we have a 5.1 million Americans with atrial fibrillation, and about 62% of these patients, roughly 3.2 million, have symptoms. Symptoms of AFib includes palpitations, irregular heart beating, shortness of breath, and if goes untreated, can lead to cardiomyopathy, weakening of the heart muscle, and eventually can cause risk of sudden death sometimes, and more commonly is stroke. As a matter of fact, AFib is the leading cause of stroke, and it increases the risk of stroke by about 5-folds. It also increases the risk of heart failure by 3-folds, and needless to say, in 2009 it contributed, or it cost taxpayers $12 billion in the healthcare industry in management of atrial fibrillation.
Talking about palpitations, Dr. Hanna, because someone might not quite understand that maybe what they're having, do you associate it feeling like a fluttering in their chest, or what are some things they should identify that they're having palpitations?
So you can have the palpitations, irregular heart beating or skip heart beating, that is what we call palpitations. And the symptoms of AFib can vary from people that are running out of breath, because the moment you go in atrial fibrillation, roughly you're losing about 25% of your cardiac output, and that can cause some shortness of breath, irregular heart beating, and sometimes you can have syncopal episodes when you're going out of AFib back into normal rhythm. The transition can cause sometimes passing out, syncope or near syncope.
Okay, and so for that small percentage that will require the ablations, talk to me a little bit about ablations and how you've seen this technology advance.
So really, over the years, I've been doing this for roughly about 21 years, and over the years the guidelines have escalated the indication for AFib from class 2B to class 2A. Now it's class 1. If you just try one antiarrhythmic therapy and it fails, then you have to be referred to ablative procedure. And delaying the referral to AFib ablation has consequences, as shown by Dr. Birch in the Intermountain Heart study, which included about 4,500 patients. The longer you delay the referral to ablation, it has adverse consequences on long-term outcome for AFib ablations and for these patients. And to talk about AFib ablations, it's a complex procedure. It involves a fully equipped EP lab involving fluoroscopy and 3-dimensional mapping using highly sophisticated computerized mapping system, and team of personnel that are well trained in the procedure to be able to carry on an ablative procedures.
Wow. Well, we are certainly thankful to have your expertise in Southwest Georgia for sure. And we definitely want to encourage people, like you said, don't ignore any symptoms. Reach out and have those evaluated.
Absolutely.
Okay, well, we certainly thank you for your time here today. We're going to take a quick break, and when we come back, we'll give you more information on staying heart healthy. Stay tuned.
Healthcare Today will answer today's medical questions so you can live a healthier tomorrow. If you'd like more information on Healthcare Today's guests or watch previous shows, visit walb.com/healthcaretoday. If you're a healthcare professional and would like to appear on Healthcare Today, contact Kelly Roberts at 446-4074 or email her at kelly.roberts@walb.com.
I'd now like to welcome Dr. James Shoptaw, cardiothoracic surgeon at South Georgia Medical Center. Welcome, Dr. Shoptaw.
Thank you. I'm glad to be here.
Dr. Shoptaw, studies show that every 40 seconds someone in the United States suffers with a stroke. And what's even more alarming is every 4 minutes someone dies from a stroke. Let's start off by talking about stroke and stroke awareness.
Stroke is something that's near and dear to my heart. My parents were in their upper 80s, and and both of them were affected by a stroke later in life. And if you hadn't sat down and thought about it or considered it, if you go from being a normal, healthy individual to having a stroke and being unable to move your arm or leg and unable to kind of take care of your basic needs, that is one of the most tragic medical disasters that can happen to a person.
And tell me, what actually happens during a stroke?
Well, as you know, the blood vessels carry the arterial blood to the organ, and then the veins carry the blood back to the heart. And if you get a blockage in an artery that's carrying blood to the brain, then the brain suffers an ischemic injury, and that defines a stroke.
Okay, now let's talk about some risk factors. What may cause someone to be at a higher risk for a stroke?
So as we know, hypertension, high cholesterol, hyperlipidemia, high triglycerides, diabetes, and cigarette smoking. Also, we would have to add obesity and sedentary lifestyle to that.
Let's talk about some symptoms, what someone may be having when they're having a stroke. What are some symptoms?
So commonly strokes emanate from the carotid arteries. And the carotid arteries are in your neck. You have one on the right side and one on the left side. And they provide blood flow to the middle cerebral arteries. And the first branch of the carotid artery, once the artery enters the skull, goes to the eye, the ophthalmic branch. And so on occasion, some of the debris from the artery can go into the ophthalmic branch and block that branch transiently. And a person may have transient loss of vision in one eye or the other eye. And then that resolves, and that's commonly referred to as amaurosis fugax. So that may be one example of kind of a mini stroke that clears. Also, one could have numbness or tingling in their arm or leg, or they could have difficulty with speech, or numbness in their face or their tongue, or difficulty swallowing.
Okay, and we've learned, they've done a lot of awareness of something called FAST, about checking symptoms with stroke.
Yes, ma'am. It's face, arm, speech, and time. So if you have difficulties moving your facial muscles, difficulty moving or feeling your arm, difficulty with speech, then that would be an indication that you're potentially having a stroke. And they talk about taking an aspirin and calling 911.
And if someone's previously had a stroke, does that put them at a higher risk for a reoccurrence?
Definitely would put you at higher risk.
And so they need to continue, want to make sure they continue monitoring like their regular appointments?
Yes, ma'am. And the neurologist initially see the patient for a stroke and define the severity of the stroke. And there's a stroke evaluation scale where they can kind of monitor the severity of the stroke. But then the question comes, why did they have the stroke? Is it a stroke because they have carotid artery blockage? Is it a stroke because they have some clot or debris in the heart that goes to the brain and causes a blockage? Some patients have a rhythm called atrial fibrillation, where the left atrium quivers and then every now and then throws a normal beat. Well, while the left atrium is quivering, then it's the blood's not moving through there, and so you can develop clot in the atrial appendage, and that can be a source of emboli that can go to the brain and cause a stroke.
And now we're going to move on and talk about peripheral artery disease. Tell me a little bit about that.
Well, I mean, just like a stroke is where you have a difficulty with blood going to the brain, then with peripheral arterial disease, you may have blockage of a blood vessel supplying the arm or the leg. And so likewise, the arm or the leg would become ischemic. Some symptoms for that may be initially that you feel fatigue with walking, or you get severe calf or leg pain with walking, or you just get general fatigue. The severity of the peripheral arterial disease could go all the way to discoloration of your toes, loss of hair on your lower leg, or frank dry gangrene of your toes where it just turns black or blue and becomes insensate.
I want to talk a little bit about people understanding the difference in someone that would need open heart surgery versus a stent.
There's a lot of discussion now in when to do a heart surgery. So first, even if you had a patient with blockages, you would want to maximize medical therapy. And what does that mean? It means that you would want to treat their cholesterol with a statin. You would want to get them on some blood pressure medicine to control their rate. And then generally, if the patient was having difficulties on maximal medical therapy and had triple vessel disease, diabetes, or left main disease, those patients would more than likely benefit from coronary artery bypass grafting as opposed to an angioplasty or a stent.
Well, you've certainly given us a lot of great information today, and we appreciate you being here with us.
Thank you, ma'am.
Stay tuned. When we come back, we're going to continue getting all the tips we need to stay heart healthy. We'll be right back.
Healthcare Today will answer today's medical questions so you can live a healthier tomorrow. If you'd like more information on Healthcare Today's guests or watch previous shows, visit walb.com/healthcaretoday. If you're a healthcare professional and would like to appear on Healthcare Today, contact Kelly Roberts at 446-4074 or email her at kelly.roberts@walb.com.
I'd like to welcome my next guest, Dr. David Hardy. Welcome, Dr. Hardy.
Thank you for having me.
Now, Dr. Hardy, you are a vascular surgeon there at the Dasher Heart Center, SGMC, is that correct?
That's right, yeah, I'm a vascular surgeon.
And tell me a little bit about what a vascular surgeon actually does.
Yeah, that's a good question, because when I tell even my friends and family I'm a vascular surgeon, they say, hey, you do veins, right? So it's a little more than that, actually, and it's more involved, but we pretty much take care of every blood vessel in the body, except what's in the brain and what's in the heart. That's usually reserved for neurosurgeons or heart surgeons that would do those types of specialties. But any other blood vessel is fair game. So things like your carotid arteries, it might lead to a stroke. Sometimes you have a clot or a blockage, and we have to clear those out. If your aorta, which is the main blood vessel, the main pipe in your body, if it has problems, then sometimes we have to go in and fix that as well.
Okay, so I want to kind of dive in for a moment and let's talk about some specific warning signs someone could have if they're having some vascular problems.
It's pretty broad. I mean, we can go back to the carotid we just talked about. So if someone has a carotid blockage, that person may present with a stroke, but most commonly their primary care doctor may find their lesions by listening to their neck or doing an ultrasound and finding out there is a blockage. And if that blockage is significant enough, we can open the neck and clear out that blockage. Sometimes those patients may need a stent in that vessel. So some of the symptoms may be, in that case, a stroke. And we all know sometimes the face may be distorted. People may have a hard time finding their words, or they may get weak all of a sudden in one of their extremities. And that's pretty significant. That's a serious those are serious symptoms that usually bring people to the operating room or to the emergency room. For an aorta, if someone had an aneurysm that's been growing and maybe they know about it, maybe they don't, and this is their first presenting symptom, but they may have bad belly or back pain that leads them to the emergency room because it can be quite severe. And sometimes this aorta is rupturing, or there's a big hole in it and it's bleeding and we have to fix it.
Are there anything that they can do to lower their risk for better vascular health?
Yes, there are, and it's the stuff we all know that we should do. I mean, and we're all guilty of it, but the things like exercise, eating better. As we get older and as those vessels get blocked or become more blocked or calcified, and we hear hardening of the arteries, there's not a lot you can do to reverse those effects once they're there. Sometimes there's not a lot we can do to reverse those effects other than surgery at that point once they become diseased. But the things you can do early on is, yes, lead a heart-healthy lifestyle, try and have low-fat diets, try and decrease your salt intake, exercise. And when I say exercise, it's not necessarily joining a gym and bench pressing 400 pounds. It's walking at least 30 minutes, 3 to 5 times a week.
Okay, and speaking to a diabetic patient population, are they at a higher risk for vascular disease?
Yeah, great question. So they are. Typically, diabetics are at higher risk for vascular disease, and the ones we see a great deal are usually with the peripheral arterial disease. Some of them may show up with a discolored toe, a painful foot, the pain with walking. Some of them may show up with an infected foot where we have to manage it and it's a little more aggressive.
Right, and I would imagine seeing you could help them possibly prevent losing a limb.
Absolutely. So if we can see them early enough, and that's the whole point of the preventative part, seeing your primary care physician, they send, like they're really good in our community sending those patients to me early so that we can manage them and try and prevent for limb loss, because that's really all we want. All of us together want that.
I want to move on to, I do want to touch, we talked a little bit about aneurysm. Is that something someone should be concerned if they have a family history of aneurysms?
It absolutely is. That's one of the higher risks associated with it. So things that can cause an aneurysm, smoking is at the top of the list, high blood pressure, and family history is probably one of the top reasons. So if you have a family member, a mom, a dad, or a brother or sister with an aneurysm, you are in generally higher risk for having an aneurysm yourself. And the scary thing is that most aneurysms are asymptomatic, so you won't even know you have it. The easiest way to look, and it's a pretty easy screening tool, and in fact, when people turn 65, the Medicare has a screening ultrasound as part of their onboarding that you can ultrasound your aorta in select populations because it's shown to improve mortality in patients who are screened for aneurysms.
Okay, and then I want to talk for a minute. South Georgia Medical Center actually has a hybrid operating room. Are these types of operating rooms common?
They're not common in every hospital. I think it's kind of one of those things to be a full operating vascular surgeon. These are pretty common for us, and this is what we want. And this is where we want to operate because a lot of our procedures nowadays are a hybrid, and we call it a hybrid room because we used to do a lot of open surgery, and then with the fluoro machines, we can do a lot of endovascular or minimally invasive. But what we find ourselves doing more these days are a bunch of combined procedures because we're able to provide the best care when you combine some of those modalities.
I want to talk about how detrimental smoking can be to a person's vascular health.
One of the biggest tools the patient has where they can help themselves. And in fact, a lot of these peripheral arterial diseases are started from smoking. And even a lot of our new information don't really recommend us operating on patients who are still smoking because, to put it simply, whatever we do is going to kind of be damaged by the long-term effects of continued smoking, and we really want those patients to stop so we can benefit them maximally.
Well, that's some great information. We certainly appreciate you being here today with us. I want to thank each of our physicians that joined us here today, and please remember that early prevention is key. Stay conscious and stay healthy. If you'd like more information on any of the physicians you saw, you can visit them at SGMC's website. We'll see you next time here on Healthcare Today.